Hey everyone, what's going on? Let's adjust this here a little bit. Should be good to go. I do have headphones, microphones, so if for whatever reason you cannot hear me, please let me know, put it in the comments. And if you can hear me, please just give me a like and let me know that you can hear me. So that way I'm not just talking and it's not recording and everything's going smoothly. So give this a minute here. All right. So hope everyone's Monday's going good. It is National Oberon Day. So for those of you Oberon fans out there, it's like the start of spring or summer, big day, but kind of going off of spring and summer. Now is the time a lot of you start running and biking and getting a little more active, trying to enjoy that weather. And with it can come some pretty nasty, pretty difficult and strenuous injuries. Today, I'm going to be talking about IT band and IT band pain and what does it all mean. So again, if you can hear me and you're listening, please give me a thumbs up. Please like it. And if not, please let me know. But I'm going to kind of get into this as far as what we're talking about with IT band issues. So, hey, Jesse, thanks for watching. Hope everything's going good in Fenton. I know you guys are probably getting some questions on this, and hope the store is doing well. So for anyone also that's watching, Jesse Anderson, he's the owner of Red Fox Outfitters in Fenton. Huge shout out to them. If you have any outdoors needs or running shoe needs, they are the people you need to talk to. So Jesse, Nick, all the people at Red Fox know they're up to date and very knowledgeable on running shoes and other outdoor equipment if you have any outdoor needs. So go check out Red Fox. But back to that IT band. Perfect. Thanks so much, Jesse. Yes, Alexa. Yeah, if you end up watching, you're gonna want to listen to this. So, IT band pain and what is the IT band? So the IT band runs from, it's on the side of your hip. Okay, it goes from the ilium to the tibia, and it stands for iliotibial band pain. And the IT band, it comes from a muscle, your TFL, your tensor fascia lata. That's not a coffee drink. That's actually a muscle on the side of the hip. And your glutes, your glute max, glute med, insert in that IT band, which then runs all the way down the side of the leg. It's a huge tendon, and then inserts into that tibia at the outside of the knee. So with IT band pain, a lot of times what it is due to overuse and due to weakness. So it's pretty common in runners and cyclists, hiking. If you're doing a lot of walking, you can get it, and it will present a lot of times as a pain right on the outside of the knee. And it comes on gradually over time typically, and just gets more irritated the more you try to maybe push through it. And so with this type of pain, a lot of people, there's a lot of myths out there on what to do. So one of the biggest things that I see is, I try to roll out my IT band because my IT band's short or my IT band's super tight. Now, you can roll out that IT band all you want, and it might feel better after you're done, and that's good. That is one way to help with some maybe short-term relief, but it's not going to fix that pain. It's not going to make it go completely away. The next time you likely go out running or cycling, it's probably going to be brought on again, and you're going to end up rolling it out over and over and over again. And why is that? When you're rolling out that IT band, you're more so just giving some input to the nervous system and making some changes there to help with pain relief versus actually making any changes. You're not going to stretch out the IT band or increase the flexibility simply by rolling. The research has shown it. That's really not going to do too much of a difference. a lot of times what we need to do is we need to fix the source of the problem, and that can be some weakness at the hips. It could be how you run. It could be if you're biking, how does your bike fit? What is the fit of your bike? It could be your foot and what type of shoes are you in? Are you in the right type of shoes? Are you over pronating or over supinating? Do you need a certain shoe for that? So all of those things can play a role in IT band pain. So the biggest number one myth though is definitely rolling out. Hey Russell, thanks so much for watching. If you guys are finding any of this beneficial or have questions, if you have questions, please put in the comments below and I'm happy to answer those for you. But again, one of the biggest myths I see is that, rolling out your IT band with a foam roller is going to fix the problem. I can tell you that, it can help. It can help alleviate some pain and with some short-term relief. But likely the people who are constantly rolling out their IT band, they're always having problems with their IT band because they're probably not doing the right things to fix that problem. And so, again, strengthening a lot of times is one of the biggest issues, is really focusing in on the proper glute activation and glute strengthening. Hey, Aunt Jenny, how's it going? Thanks so much for tuning in. So a lot of people, in regards to that IT band attaches to the TFL and the glutes. The glutes oftentimes are weak. They overcompensate with hip flexors and with running and with certain activities. So then you're getting increased friction distally, so further away, and that means so towards the knee at that insertion point, and that's where you're getting a lot of that pain. So really focusing on that strengthening component, you can be doing some bridges. Clamshells, those are usually a pretty good, easy way to start. Those are simple exercises that you can do to work on that pain. And again, by no means are those for everyone. There's not a one size fits all when it comes to therapy. You really need what's going to address your symptoms, but those are pretty simple and easy exercises that you could start with if you haven't seen, a physical therapist or sports physician or anyone in that realm yet. Hey, Aunt Katie, thanks so much for watching. Hey, Judy, thanks for watching. Megan, glad you guys are on here. Stephanie. So foam rolling in the short term can be helpful. Strengthening. Looking at if you're a runner, cadence, and how you run. So are you rear foot? Are you heel striking? Are you a forefoot striker? What is your knee exactly doing when you strike that ground and in your mid stance? Do you valgus a lot? Is your knee dipping in quite a bit? Are you over pronating a ton? That can really cause a lot of added stress at that IT band and at the knee. How is your stride, the extension of your hip? All of that can definitely play a role. So getting a video analysis on your running form and mechanics can play a pretty big role and can really help help you hone in on some key aspects there. And not only then can you help to fix that IT band, but a lot of times if you fix some of those impairments that are involved with your running, then you can also become a better runner. So, and then for cyclists, is your bike, does it fit properly? Do you need to adjust the seat or the handlebars? Where are your feet at the very bottom when your knee is fully extended? Where is all that? So those are some pretty key points there. And then also a big thing that I really find with a lot of people is footwear and shoes. And so going back, if you're in Fenton on the east side, check out Red Fox. They can help you out there when it comes to the shoes. And with the shoes, a lot of times when I ask people, oh, how old are your shoes? They're like, oh, they're like a year or two old. Like, I never wear them. It's like, well, if they're 2 years old, that material a lot of times has broken down and those shoes are not going to be as effective. Just because you haven't worn them hardly for 2 years doesn't mean that they're going to be still necessarily good for you. And so really you should probably look at getting another pair of shoes if those are broken down. You don't want too many miles on your shoes, just as much as you don't want those shoes to be too old. Jenny, how often should you replace I'm assuming you're going to say shoes. I don't see the other part. so you should replace shoes. Really, I say, for me, I try to replace mine every 6 months to a year. So if you're an avid runner, really every 3 to 6 months, if you're running year round, should be when you're getting new shoes. If you are more seasonal, you can probably get by with once a year getting new shoes. I'm more of a seasonal runner myself. I'm running typically in the warmer months, spring through the summer. I'll usually start with a new pair in the spring. Jesse, thanks so much. Yes, 350 to 400 miles is the industry standard. Thanks, Jesse, for hopping in on there. And so 350 to 400, and again, that duration is going to differ from person to person. Just like Jesse said, every model is different, and how hard you are on your shoes is also going to play a big factor. How your running mechanics are, and then what events are you also training for? Are you doing a bunch of marathon training on on cement and on the road, or are you doing more trail running? That's going to have an effect. All of those things can differ, but if you see your shoes are wearing down, it doesn't hurt to go in, have a professional look at them, someone at a running store such as Jesse, or if you take them to your physical therapist, they can usually tell you. But more often than not, with these people, I'm usually seeing that their shoes are older than a year. But if you're an avid runner, again, like Jesse said, 350 to 400 miles, industry standard, every model is different. Really, I try not to tell anyone, really 3 to 6 months if you're a runner. And if they're older than 6 months and you're getting IT band issues, I'd probably go and look at getting another pair of shoes, just to be safe there. So that can also lead to other issues if your shoe isn't the right fit, if it's not for you, or if it's too worn down. You can likely then start to get other injuries, hip issues, back issues, knee, foot, ankle, Achilles. The list can kind of go on if those shoes are causing you to compensate and changing up your form there. So those are the big things. Another again, thing that I find with IT band, one thing that you can try to do to help in the short term, a lot of people ask, well, heat or ice, which is better? It really depends on your preference. There's different things you can use, like BioFreeze, to help with short-term relief. Again, that's not going to cure it, but it can help with short-term relief in getting you through a pretty painful episode. You can rub BioFreeze or do like an ice massage. You just take a Dixie cup, fill it with water, freeze it, tear away the rim, and then you just rub that on the part that's sore or painful for about 5 minutes. It'll cause that area to go numb, and usually that can help a bit. So those are, I would say, the biggest things when it comes to IT band pain that I find. If you are interested in some of my top 3 exercises for IT band pain and helping with that, I would be happy to send those to you. So just put in the comments below IT band and I will send those over to you. And if you find this helpful, please give this video a like, love it, share it with someone who's dealing with an IT band issue, and hopefully they find it beneficial. And if they want to message me, or if you want to message me with further questions, I'm more than happy to answer those for you. So you guys have a great Monday night. It's finally getting warm. Spring is here, it looks like, and I will be on again next week with a new topic. So if there's anything specific also that you want me to talk about, don't hesitate to let me know, and I will make that happen. Thanks so much. You guys have a great night.